Hi, very good morning, everyone. This is Sabyasachi Bharti again. As you know, that CMS VATAVARAN Asia's largest environmental and wildlife film festival is having its 11th competitive edition, first time in hybrid mode, and all these films, which were handpicked by the 30 prominent juries from India, all across India, from different week of life. You can see those films on various issues like climate change, environment, wildlife, sustainable technology and development, and other genres. Also on India Science OTT channel. India Science OTT channel is a OTT channel initiated by Department of Science and Technology and Vigyan Prasar, an autonomous body in Department of Science and Technology, Government of India. As you know that the festival is live till 23rd of April, and on 23rd of April at 11 o'clock we will be having award ceremony, online award ceremony, which I invite you all to join. So every day we do talk with some of the very prominent person, talking about various aspects of environment and climate change and things related to it. So as you already know that today I'm going to talk to I can say that it's my honor to talk to one of my very good friend and my mentor also, Nikita Sarah. Nikita is head of advocacy and communication at the Leprosy Mission Trust India, an international NGO working on restoring health and dignity of people affected by leprosy and other disabilities. Uh, no need to mention that she is a seasoned development professional and a stellar communicator, and it's my privilege that I had the chance to work with her a few years back, and it was a great learning working with her. She is a leader who believes in leading by example. Nikita mentors and empowers others to take initiative in creating sustainable communities and enabling environment for the most vulnerable communities with a wider lens of women, as she believes that women are the real influencers and change makers. And mark my words, she is really a good influencer and change maker. So we will talk with her about the changes she is trying to do in the society. Among her most significant contributions has been the successful repealing amendment of 20 laws that discriminate against the most vulnerable group in India. She is credited with the conceptualizing an innovative national public health campaign, Sapna Hai Kusht Mukt Bharat Ka, which has been adopted by the government and rolled out across India. Nikita is also mentor for women facing domestic abuse, part of Single Parent Squad, and member of a fantastic network of support group of parents with children with autism. She is comfortable leading the complexity, gets fueled by a challenge, and a passionate believer in the power of social change. And today we will be talking with Nikita about the role of climate change on the spreading of neglected tropical disease. Kindly join my hand and welcome Nikita Sara. Hello, very good morning, ma'am.
Good
Uh,
morning, and thank you so much for the wonderful and the warm welcome. Thank you.
Thank you, ma'am. Nikita, as we know that you are working with the Leprosy Mission Trust for such a long time, I had the privilege to working with you for 2 years in from 2005, 13 to 2015, and I can say that whatever I had said is 100% true because it's a first-hand experience. You mentor me a lot, and I remember that you asked me to, see the Heal India campaign, and you helped me a lot because a campaign was a new thing for me that time. So uh, I know about the Leprosy Mission Trust India, what it's doing, but the viewers who are watching us, can you tell uh, uh, about the TLMTI, the Leprosy Mission Trust India, how it started and how it's and where it's working, ma'am?
Sure. Thank you so much, Sabisachi, for this awesome opportunity. Really privileged to be a part of this talk. And I've been watching you for a very long time and just to know of the kind of work that you're doing and so proud of everything that you're doing. I'm happy to have mentored you in some part of your journey, a very small part of your journey. So yes, I've been working with the Leprosy Mission for about more than 10 years. It's going to be 150 years in another year. It's a 150-year-old organization working in the field of leprosy and other neglected tropical diseases. We have 14 hospitals, 6 vocational training centers, and about 10 community projects all over in India. We work out of 10 states, and our core focus is leprosy. um, and other than that, we support not just people affected by leprosy, but people from the other marginalized community, people with disabilities, in training them with vocational skills, both in institutional and in community setups. And we have some amazing projects because people affected by leprosy are the most vulnerable, and they fall into poverty, or the whole circle of poverty because of leprosy. So it's very important to ensure that they have the skills, that they are sustainable, and they have a very good life. And despite of the disabilities and stigma they face, they can live in an inclusive society. So while we work with people affected by leprosy and other marginalized sections of the society, we also work with people. We work with many stakeholders like the government, civil society organizations, because we feel that we cannot do anything without partnership. And partnership is one of the most important things that we do. So all our 14 hospitals are referral hospitals for the government of India. We also work on the awareness campaign. So right behind me, you can see Sapna. She is a mascot for Leprosy Free India, and it's been a very exciting thing. So many people may be just wondering that 150-year old organization, leprosy, does it still exist? Is it
Mhm.
really, what is leprosy? So in fact, when you and I also joined the organization, we
Yes,
never knew that leprosy existed.
yes,
It was a great working environment, but it's only when you started working we realized that every 4 minutes there's somebody who's diagnosed with leprosy, and that is just a registered number. And but many people are not aware that leprosy is easiest to treat and easiest to cure. But if it's delayed, if the diagnosis is delayed, or the person comes late for treatment, the person can develop deformities and disabilities, and that can lead to a lot of stigma and discrimination. So one person,
there
and yeah,
Nikita, there is a lot of stigma itself related with the word leprosy. Isko to
right.
kusht ho gaya hai, ya when we curse someone we say. So there is so much of a kind of stigma and hate related to this word. So uh, can you tell us a little about how you are working towards talking about these stigma there in the society?
So yeah, very interesting that you mentioned it, because yesterday only I was in a conference and somebody, a minister was talking, somebody, a very senior government official was talking about क्यों है स्टिग्मा, मतलब कैंसर भी है, ट्यूबरक्लोसिस है, पर कुछ के साथ ऐसा स्टिग्मा क्यों है? एक सिंपल रीजन है, because leprosy is one of the oldest diseases known to mankind. It's referred in every religious book, whether it's the Bible, the Quran, or the Mahavedas. And mostly the reference is made because of karma, and or a dirty disease or something that you've done in your past life. It's not associated, it doesn't have the right connotation. But and now leprosy is completely curable. In
Mhm.
1980 there was a complete cure, so people can get detected, but the stigma continues to live on. The stigma has not gone anywhere, and the stigma can be manifold and its whole spectrum. So while as a person affected by leprosy, if I am diagnosed with leprosy, I may just have a lot of stigma within myself, because I've seen all negative imagery across in the media. I may think that, oh, now I have stigma, I'll get deformed, nobody is accepted. So that is already there. Then there's perceived stigma, there's public stigma, and then there's a lot of stigma in the sense that we have 119 discriminatory laws. We had. Now we worked with the government of India to repeal it, because these laws existed because of the Lepers Act, and the Lepers Act has already been repealed, but these source and host of other laws have not been repealed. So they again perpetuate stigma. And usually discrimination is the action that happens because of the stigma, happens generally to people who have some form of deformity. And so there have been a lot of awareness campaigns that we have been doing, like Heal India Awareness
Yes.
Campaign, which you were a part of. Heal mean hire, accept, educate people affected by leprosy.
Leprosy.
So there's a lot that's being done in creating awareness and driving away stigma and discrimination, because India still accounts for 60% of the global burden.
Yeah.
One of the
I was just
reasons,
I was just coming on that question, that what is the current scenario of leprosy, because when we talk about leprosy हमको लगता है अब तो leprosy है ही नहीं.
huh, exactly. So India accounts for about 60% of the global burden.
Wow.
And we have a lot of cases who come forward because of they come late for diagnosis with deformity and disability. And so it disproportionately affects women and children as well. There are close to about 50 women who are diagnosed with leprosy every day. There are close to about 30 children who are diagnosed with leprosy every day. So ये कहीं नहीं गया है. Leprosy, it's very much there, but the government is working very hard on active case detection camps, door to door, looking for patients. So the work is very much on.
Yeah, yeah. Now coming out of from leprosy, one of the thing that we wanted to talk about it, because even the Leprosy Mission Trust understands the impact of climate change which is happening there. So
Absolutely.
so, and CMS Vatavaran Film Forums, one of the point of discussion is the impact of climate change in various aspects of life.
Hmm.
And as it's the month of April, and now June and July, the extreme weather, the extreme heat will be there. And we have seen that in during these few years, this due to climate change and global warming, that extreme weather condition is becoming harsher and harsher every year. So can you tell me, like, what these this impact of climate change and the extreme weather events uh, 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 effects on the access to the healthcare services, because Leprosy Mission Trust provides healthcare in country, and it works very closely with the government of India in the health sector.
Right. So, since you're talking about neglected tropical diseases, I must tell you a little bit about entities also. And as you rightly pointed out, that the climate change is rapidly happening. In January, we experienced extreme winters, and now in summers, it's like extreme. It's mid-April, and it's already
It just
45.
started.
Yeah, so it's terrible. So, neglected tropical diseases, as it's
Yes.
also known as, the entities are a diverse group of about 20 conditions that are mainly prevalent in tropical areas. And most of these entities affect are highly disabling and also are chronic in nature. And these affect most of the people living in poverty areas or the impoverished communities, and they disproportionately, like most of the diseases, affect women and children the most. And
Wow.
they have a absolutely devastating health, social, economic consequences, and more than 1 billion people are affected by this. Today, again, India is number one among many things, and it absolutely experiences the world's largest absolute burden of 11 major entities,
Wow.
which is quite big. And there are certain circumstances like endemics or pandemic, political. I mean, we've stopped using the word pandemic, but it's now come back in our dictionary. So, pandemics, political instability, migration, and especially climate change. And antimicrobial resistance increases the complexity of the situation and requires additional action. So, as you were talking about the impact of climate
Climate
change
change.
on, yeah, so I'll just take a little example of the cyclone that happened a couple of years ago, the Amphan, which hit India sometime in May 2020. In the Sundarban region of West Bengal, it was hit very, very hard. It swept away the bridges, hundreds of houses, and destroyed so many public health centers. It destroyed close to more than 500 public health centers, more than 5,000 sub centers, and
Mhm.
there were close to about 13,000 child development centers that were destroyed. So, getting access to clean, potable drinking water became a huge challenge, and the health
Mhm.
services were not only affected, they were rendered completely inoperative.
Mhm.
I'm taking an example of another thing. There is a lady by the name of Chandra, and she lives
Mhm.
in Kadalur, which is the coastal area of Tamil Nadu. And
Yes.
due to delayed diagnosis of leprosy and treatment, she had severe deformity. So she lives in a village that is prone to floods. Now, what is happening because of the climate change? There is all the more frequency of flooding has increased so much that her house always gets submerged in water, and because of her deformity she develops a lot of ulcers and a lot of other issues that and she has to move into nearby houses. So access to livelihood and any healthcare service providers is completely affected, and then she has a disabling condition because of that. So this is a bit of the impact on the various entities, and also because of floods, snake bites increase. The cases of rabies because the dogs don't get food, so it becomes rabies increases, snake bites increases. There, a huge amount of increase in the entities, especially during the changes
Mhm.
happening because of
Mhm.
the climate.
So, as we are talking about entities, can you tell us? We talked about the impact of climate change. How on the entities and its spreading. So, how climate change is helping in the spreading of and the transmission and the distribution of these disease.
All right. So entities are caused by a variety of pathogens, viruses, bacteria, protozoa, and parasitic worms. Now these pathogens are carried and transmitted by humans by vectors like mosquitoes, flies, and the incidence of this disease may increase with changing climate and rapid urbanization also. So,
Mhm.
changing rainfall pattern can determine the suitability of the habitats for vectors and host through increased breeding sites also. Um, Now, with the temperatures rising, it makes many areas completely non-suitable and very conducive for transmission of dengue,
Mhm.
chikungunya, and other
Mhm.
diseases. For example, in many parts of Central Europe and in
Mhm.
US, and changes in the distribution of such disease may put additional
Mhm.
population at risk and undermine the
Mhm.
current disease control programs.
Mhm. Okay. So, Uh, can you tell us more about like entities and how in which part of the India these entities are affecting and spreading, and some of the what I know is in our region there is one disease in just which in the local language we say hathi pav.
Yeah.
Yeah, and this is probably is also one of the entities.
Absolutely, absolutely. So, like leprosy, we have certain endemic areas, and
Mhm.
similarly, entities also have certain endemic areas. So,
Mhm.
it would be spread across all over in India because we have
Mhm.
one of the largest populations also.
Mhm.
And plus, in India, the temperature varies right from north to south,
Mhm.
and then we have coastal regions all over. So the distribution of these entities across 11 would take another half an hour to explain. So I'm not getting into it, but yes,
Yeah.
most of the places in India in geographical areas you will find. See, like example, one of the entities dengue. You will find it
Okay.
in part of
Okay. So dengue is one of the entities,
yeah,
and then
because
it's like these days you can have dengue in Delhi. Like every year we have this dengue ka time.
absolutely, absolutely. So but the distribution is all across.
Yeah. So, ma'am, if now, so this was a problem. Yes, the climate change is happening, and due to climate change, the transmission and distribution of these entities are happening in a faster pace. So, to reduce the impact of climate change on these entities, like what you can, I know that climate change is not a it's not a very simple thing. There are so many layers and it's a international also. But what recommendation do you have to reduce the impact of climate change in these diseases?
See, one of the things that we need to do is increase our understanding of interactions between climate change and the emergence of these neglected tropical disease, and allow for implementation of very targeted public health measures. Uh,
Mhm,
Local communities and volunteers play a very, very big role. So we need to also take the help of local communities and volunteers to identify and map households with
mhm,
persons affected by leprosy and other neglected tropical area diseases in especially disaster prone areas.
mhm,
This can really help in a very, very quick response, especially when the disaster strikes. Although the WHO has got a roadmap, 2020 roadmap to eliminate at least 10 neglected tropical diseases, India
mhm,
is committed to providing resources to remove the primary factors for NTD,
mhm,
which is poverty and exposure to clean and safe drinking water and
okay.
basic sanitation. So, in the wash, and you've seen that we are running a abhiyan in India for clean India. So these things, the factors that contribute to NTD, poverty, exposure to clean, exposure to water, and basic sanitation and integrated vector control, health education, and improved living conditions will definitely help in reducing the risk factors for NDT. Whereas at the national and at the state level,
Mhm,
we have laws and policies, disaster management plan, then the
yeah.
government disaster response, infrastructure,
Mhm,
and apparatus that needs to be complemented with both
mhm,
personal awareness. So there is a huge need for a lot of awareness, like we are doing among, in leprosy. Similarly, for all the entities, there's a huge need for awareness and preparedness within households, awareness raising campaigns by NGOs and community based organizations and volunteers. So, as one could see in the last pandemic, also that all the NGOs came together, all civil
mhm,
society came together to create a lot of awareness, because that's when the government reached out to them that they couldn't alone, you know, target all the population, especially in hard to reach areas, dark media areas. And I think that the most important thing is that how we prepare for it and how we come together and partner to ensure
ji,
that there is a reduction in the whole
ji.
of this.
So,
Yeah.
so what Leprosy Mission Trust is doing, or what is its plan to tackle entities like is Leprosy Mission thinking of some long term plan to implement something like that?
Yeah, so it's very interesting to note whether each state has a different. But leprosy is very challenging and complex also. While one state people may report late because of the stigma attached to it, they may be completely aware about the signs and the symptoms. Whereas the other state in India, people report late because they're not aware about it. So we work very, very closely with the government. We are working on a very interesting model called the replicable model.
Mhm,
And this is going to start in Chhattisgarh, because we've gone and done a formative assessment of all the stakeholders. So the multiple stakeholders that contribute to reduction of any kind of disease, right from the
mhm,
policy makers to people affected by leprosy to the arm janta. So it's very important to understand the perception of each of these and then come up with a campaign. So we are thinking of state-wise campaign and working with all the stakeholders to ensure that we come up with a very interesting and an innovative campaign, and then take it forward and replicate it in the other states. So this is
ji,
something at the moment we are focusing on, and of course through our
mhm.
hospitals, we are focusing on doing case detection campaign, health camps to detect this.
Yeah. So now, so we talked about these serious issue. Now coming out of it, and can we talk something about your journey? How was your journey, and why you decided to join Leprosy Mission? What was your background, ma'am? And one more thing, like you also support or parents having autistic child. So how was your journey? Because you also have a, you had blessed by three son, and one is having the autism. And so how you are dealing with the external challenge, the internal challenge, and how you are coping it, how you are balancing it.
One of the thing is that our creator is absolutely amazing. So whenever I have too many challenges, I just throw it to the universe and I ask it to handle. एक मेरी फेवरेट चीज है कि जब किसी चीज की बहुत ही शिद्दत से आप चाहते हो ना, तो the whole universe conspires to get you that. So
Yeah.
it's been a very interesting journey. I wasn't in the development sector. I was in the corporate sector, handling communication and business development. And then it is just by accident I got into the development sector. And till I got into the leprosy mission, I really didn't think that I would be here for many years. The kind of work, and not the work, the passion with which people do work in this organization, the transparency, and the huge need that is there is something that has come kept me in this organization for so long, and totally committed in achieving what I set out to do. So yes, they
Agree.
have a lot of challenges. Personally, also being a single parent to three boys, but luckily I was best with the best boys in the world. So, so who've always given me that kind of support. And yes, my son who has autism, he is non-verbal as well. So it's been a very enriching journey because of it. I would say
Mhm.
today I'm here is because of my second son Yash. Um, and yes, what we require, the learnings that I've had being a mother to a child with a disability or different abilities have really helped me, unpackage it while I work at the Leprosy Mission. And it's the support of people who have children with autism, or it's the support networks that really make it strong. And even at the
Mhm.
Leprosy Mission, we find that although leprosy is one of the 21 disabilities recognized in India, people affected by leprosy rarely come forward to talk about it. They'd rather be the invisible masses or the hidden few. So, at this organization, we have also set out to empower people to be the change agents. And in fact, recently we had an amazing, national workshop with a lot of women coming from all over India, some who sat on the train for the first time in their life.
Wow.
And they have been creating so much of change and working as change agents in their villages, in their districts. So it was, we didn't call them to teach them anything, we in fact call them to learn from them. So it's been an amazing experience. And yes, the journey has been amazing with the three boys, and I'm really blessed and with great friends like you.
Uh, uh, Ma'am, the last question. You are also, working with the women who are, domestically abused. So how you and why you did, like, what are the experience like, and how you are helping them? Can you tell a little about it? Because why
Okay.
I'm asking,
Yeah.
because we are also doing a hard and now a campaign which talks about the gender discrimination in tier 2 tier 3 cities in India and its impact on women empowerment. So we also come across so many these kind of abusive story in around us when we are doing the sessions. So that's why I'm interested to know, ma'am.
Right. So, I've seen people talking a lot about domestic violence in the last 1 or 2 years of pandemic also. And there have been many cases of domestic violence, but everybody doesn't talk about it. It takes a lot. And somebody who's gone to university, learned about gender violence and all, cannot lead this show unless you've experienced it yourself. So
Mhm.
some of the most powerful advocates that I work with are people who have experienced it, who
Wow.
know about it, and then they're leading this. Because unless you've experienced it, you will really not know. It's very easy to say, there was a case of domestic violence very recently, and there's a group that I'm part of on WhatsApp which talks about violence against women. So I said, this woman is facing, domestic violence. Does anybody have any solution? Everybody offered the solution like, yeah, there's a shelter, send her there. But are a shelter equipped to take people if today a
Hmm.
woman and a highly empowered woman or a working woman in a city like Delhi is facing domestic violence, where does she go? We don't even have infrastructure created. So we are working at the grassroots level at looking at how can we help people, how can we help them as they transition out, because many people are stuck in marriages and in homes because they cannot move out of it.
Yeah.
So there has to be, yeah.
I'm extremely sorry, ma'am. I know that this is very interesting subject, and we should have more time on our hands. So probably we will have another session, and we will talk about these
Absolutely.
things once we will, and then I also want to invite you to some of the session of her and now where we can discuss about it. But as we don't have time left, so I have to to close the session here. So thank you very much, ma'am, for taking time out and talking to us about the impact of climate change on NDT and the scenario of leprosy and the work of Leprosy Mission Trust here. Thank you very
थैंक
much,
यू
ma'am.
सो मच, थैंक यू सो मच सब्यसाची फॉर इनवाइटिंग मी. आपने बहुत आउट ऑफ सिलेबस क्वेश्चंस पूछा है, बट दैट्स ओके. थैंक यू.
Thank you very much, ma'am. Have a great day, ma'am.
थैंक यू.
So, friend, this was Nikita Sarah, and we talked about the role of the impact of climate change on the spreading of entities, and also about the leprosy condition in India. In the evening, we will be talking to a very wonderful filmmaker, Rakesh Rao, National Science Award winner filmmaker, and we will be discussing his journey and his wonderful work. Rakesh Rao is probably the only filmmaker in India who has visited all these three. He visited Arctic, Antarctica, and the Everest. So it will be a very interesting discussion about him and his journey and his film. So thank you for taking your time and joining us this morning, and we hope to join you in the evening at 4 o'clock. Thank you. Have a great day till then. Goodbye.